Hello everyone. Today we will learn how to perform MMT for dorsal interossei, palmar interossei and lumbricals. So what is dorsal interossei? We have learned in anatomy that we have four dorsal interossei situated on the dorsal aspect of the hand. It has two heads, lateral and medial head. Each dorsal interossei has lateral and medial head. You can see in the picture the first dorsal interossei is coming from the first and second metacarpal bone and is getting inserted to the proximal phalanx of the index finger, and the attachment is towards the radial side of the proximal phalanx of the index finger. Second dorsal interossei is coming from the second and third metacarpal bone and it is getting inserted to the proximal phalanx of the middle finger on the radial side. Third dorsal interossei is coming from the third and fourth metacarpal bone. It gets inserted to the proximal phalanx of the middle finger but on the ulnar side. Fourth dorsal interossei comes from the fourth and fifth metacarpal bone and gets inserted to the proximal phalanx of the ring finger on the ulnar side. So according to the alignment and vector of the muscle, we can predict the function of the muscle. So what is the function of the first dorsal interossei? The first dorsal interossei pulls the index finger towards the thumb. That is called as abduction of the index finger towards the thumb. Second dorsal interossei pulls the middle finger towards the index finger and it is called as abduction of the middle finger towards the index finger. Third dorsal interossei creates abduction of the middle finger towards the ring finger, and the fourth dorsal interossei creates abduction of the ring finger towards the little finger. So these are the functions of dorsal interossei muscle. Now, if we want to check the strength of this muscle, we'll ask the patient to perform these functions. And if patient is able to perform the functions properly, then we'll move on to grade 4 and 5 MMT testing by applying resistance. So now let's check how to position the patient here. For this dorsal interossei MMT testing, we'll position the patient in sitting or supine. And for test movement, we'll ask the patient to perform abduction of the index finger towards the thumb for checking first dorsal interossei. If patient is able to perform the abduction of index finger towards the thumb to a full range, we'll move on to grade 4 and 5 MMT by applying resistance against that movement. That would be applying resistance against the radial side of the index finger in the direction of middle finger. For checking the second dorsal interossei, we'll ask the patient to perform abduction of the middle finger towards the index finger. For checking grade 4 and 5, we'll apply the pressure or resistance. That would be pulling or pushing the middle finger towards the ring finger by the therapist. For checking the third dorsal interossei, we'll ask the patient to perform abduction of the middle finger towards the ring finger. And while applying resistance for grade 4 and 5, we will pull or push the middle finger towards index finger. The last dorsal interossei we can check by asking the patient to perform abduction of the ring finger towards the little finger, and the pressure can be applied by pulling or pushing the ring finger towards the middle finger. So basically we ask the patient to perform the function and then we resisted the function to check for grade 4 or 5. So let's view this demonstration. For checking the function of the first dorsal interossei, we have to ask the patient to perform abduction of the index finger towards the thumb. So once the patient can perform, we'll apply resistance. For checking second dorsal interossei, we'll ask the patient to perform abduction of the middle finger towards index finger and apply the resistance. For checking the third dorsal interossei, We'll ask the patient to perform abduction of the middle finger towards the ring finger and apply the resistance. For checking fourth dorsal interossei, we'll ask the patient to perform abduction of the ring finger towards the little finger. So this was the technique and methods for performing MMT for the dorsal interossei. Let's move on to palmar interossei. You can see in the picture palmar interossei. We have four palmar interossei. The first palmar interossei comes from the metacarpal bone and gets inserted to the proximal phalanx of the thumb. It comes from the first metacarpal and inserts to the proximal phalanx of the thumb. Second palmar interossei comes from the second metacarpal bone and gets inserted to the proximal phalanx of the index finger, and the insertion is towards the ulnar side. The third palmar interossei comes from the fourth metacarpal bone and gets inserted to the proximal phalanx of the ring finger on the radial side. And the fourth palmar interossei comes from the fifth metacarpal bone and gets inserted to the proximal phalanx of the little finger on the radial side. So what are the functions of this four palmar interossei? The first palmar interossei causes adduction of the thumb towards the index finger. Second palmar interossei creates adduction of the index finger towards the middle finger. That means it pulls the index finger towards the middle finger. Third palmar interossei pulls the ring finger towards the middle finger, also called as adduction of the ring finger. And the fourth palmar interossei creates adduction of the little finger towards the ring finger. So while checking the strength of this muscle, we'll ask the patient to perform these functions. So the patient position will be sitting or supine, and we'll ask the patient to perform the function of first palmar interossei to check the strength. The performance would be adduction of the thumb towards the index finger. Now to check the grade 4 and 5, we'll apply resistance. That would be pulling or pushing the thumb towards radial direction by the therapist. That would be the resistance, which would be opposite to the function of the muscle. For checking second palmar interossei, we'll ask the patient to perform adduction of the index finger towards middle finger. And to resist the function, we'll pull or push the index finger towards the thumb. For checking third palmar interossei, we'll ask the patient to adduct the ring finger towards the middle finger. And to apply resistance, we will pull or push the ring finger towards the little finger. Finally, for checking the fourth palmar interossei, we'll ask the patient to adduct the little finger towards the ring finger, and while applying resistance, we will pull or push the little finger towards ulnar direction. So these are the methods to perform MMT for the palmar interossei. So let's check the video. For checking first palmar interossei, we'll ask the patient to perform adduction of the thumb towards the index finger. For checking the second palmar interossei, we'll ask the patient to adduct the index finger towards the middle finger. For checking the third palmar interossei, we'll ask the patient to adduct the ring finger towards the middle finger and apply the resistance. And for checking the fourth palmar interossei, we'll ask the patient to adduct the little finger towards the ring finger and apply the resistance. Now let's check for lumbricals. So attachments we should be knowing from anatomy. The lumbricals comes from the tendon of flexor digitorum profundus. You can see here four tendons of the flexor digitorum profundus. The index tendon originates the lumbricals 1. Lumbrical 1 comes from the index tendon of flexor digitorum profundus and gets attached or inserted to the proximal phalanx of the index finger. Second Lumbrical comes from the middle finger tendon of the flexor digitum profundus and gets inserted to the proximal phalanx of the middle finger. Third, lumbrical comes from the middle and ring finger tendon of the flexor digitum profundus and gets inserted to the proximal phalanx of the ring finger. You can see in the picture here. The fourth lumbrical comes from the uh, ring finger and the little finger tendons of the flexor digitum profundus and gets inserted to the proximal phalanx of the little finger. So the function of these lumbricals together is extension of the interphalangeal joint of the finger, simultaneously flexes the metacarpophalangeal joints of the fingers, that is from second till fifth digits of the fingers. So this is the function and the attachments of the lumbricals. Now let's check how to perform the MMT. So for performing MMT, we'll ask the patient to be in sitting or supine position and ask the patient to perform the function of this muscle, that is extension of the interphalangeal joint and flexion of the metacarpophalangeal joint, as you can see in the first picture. And to apply resistance, we can apply resistance against the dorsal surface of the middle and distal phalanges in the direction of flexion. And in second phase, we'll apply resistance against the palmar surface of the proximal phalanx towards the direction of extension. Or simply we can ask the patient to hold something like a paper, and we'll try to pull the paper against the function of the lumbricals. If patient is able to hold the paper with strong contraction of the lumbricals, we can grade the muscle accordingly. Here in this video, you can see the function of the lumbrical, that is flexion at the metacarpophalangeal joint and extension at interphalangeal joint. And then we'll ask the patient to hold the paper. We'll try to pull against the contraction of the lumbricals and grade the muscle strength accordingly. So these were the methods for checking MMT for dorsal interossei, palmar interossei, and lumbricals. Thank you.